Hello, I'm Dr. Andrew Neville, and I'm a naturopathic doctor. I specialize in treating adrenal fatigue, but I want to talk to you about what to do in the process as you're trying to figure out what's going on with you, what to do if your doctor's not listening to you. And this is incredibly common. Unfortunately, I hear these stories all the time when new patients come in to talk to me about their symptoms, seemingly unexplained symptoms, right? And they've been on this journey, right? This same kind of healing journey that I ended up being on, where, they're going to their various general practitioners or primary care doctors who are honestly stuck in a really difficult system where the insurance companies make them see a certain amount of doctors and they have to speak into computers and write down codes and all these various things. It's hard for those doctors actually to become maybe the doctors they had intended to become when they went into med school. But you go to these doctors and the blood work is normal and the doctors they don't have a ton of time to talk to you, and they seemingly don't listen, right? And then if they can't find any of these problems, what happened? Well, let's refer you out to a specialist. You got cardiac symptoms, let's go to the cardiologist. You got GI symptoms, send you to the gastroenterologist, immunologist, rheumatologist, neurologist, endocrinologist, like you name it, right? And eventually, once you go through that specialist merry-go-round that I was on as well, you get that final diagnosis to the psychiatrist, right? Because if I can rule out all these various things, nothing is organically wrong with you, it must be all in your head. We have this tendency, right, in medicine to kind of psychologize problems that we can't find answers for. Whereas a more honest answer might be from one of these specialists or whomever, you've got some things wrong with you. I just don't know what they are. And maybe on top of that, but here, let's try to think about it and let's try to figure it out, right? That's kind of a best case scenario for a lot of my patients. But a lot of my patients come into me with stories that are horrendous. That makes me embarrassed to be in the medical field as to how these patients are treated, right? When you challenge or ask, not even challenge, right? But just when you ask questions of your doctor, well, could it be this, right? They become accosted, right? And how dare you challenge my all-knowingness? I don't know what it is, but and then that creates this adversarial type of relationship, right? Or they're kind of working on a computer and somebody's talking to them and they're just punching into the computer and you're just not heard, right? You're not listened to and not believed, right? Now, worse than that, I've had some patients be almost accosted, right, by some of these doctors, these specialists, right, where they consider them non-compliant, right, because they react adversely to supplements. But doc, I'm sensitive. Well, nobody's sensitive to this, but I am, and they are, right? Anybody with adrenal fatigue, especially, is going to be sensitive, right? So one of the keys that I find that's important as I'm working with patients is I believe them. Right, I believe them. They're telling me their story. I believe their symptoms. And we think about this in terms of biochemistry and physiology, and it all makes perfect sense. Even if you can't find this information on blood work, these dysfunctions are real. It's just that kind of these doctors unfortunately have blinders on. So what do you do if you're not being paid attention to, you're not being heard, you're not being listened to, or you're being outright kind of challenged and yelled at even? Walk away. Walk away. Find somebody who can give you those answers, or at least find somebody who will listen and try. Get a second opinion, get a third opinion. And if that doesn't work, move away and look towards perhaps some other avenue. Naturopathic doctors are definitely along those lines. Even integrative doctors, right? Docs that have been trained, they're MDs and DOs, they've been trained in more natural medicine. They generally are more thorough, they take more time, and they're generally nicer about approaching patients. Even they miss the cause sometimes, right? But at least they will put in a little more effort at trying to find what's wrong with you. They will tend to listen in a better way. There are always answers to the questions you have. Whether or not that person in front of you can give those answers to you, well, that's another story. But don't stop trying. All my best.